Hi everyone, and welcome to today's webinar, How to Avoid Wellbeing Washing and Create an Authentic and Inclusive Culture. I'm Charlie Robson-Buck, Culture and Development Business Partner at Westfield Health, and today we're joined by Vicky Walker.
Hi.
And Kathy Lawson.
Morning.
So first, just some housekeeping. The webinar today is being recorded and you'll receive the recording shortly afterwards by email. You've joined in listen only mode, so if you have any questions, you can type them into the questions box and we'll try to answer as many as we can. You should see a questions section on your screen. You'll see some resources that you can download in the handouts section. These include a mental health resource guide and wellbeing survey sample questions for HR teams and managers to support their employees. During the webinar, we'll be taking a poll to include the audience members' experiences. This is completely anonymous and optional, but we will share the overall results. They're a really interesting way to learn from your peers too. And finally, a survey will appear on your screens at the end of the webinar. It would be great if you could give your feedback, as we do use this when developing future webinars. So yesterday's theme for World Mental Health Day was Mental Health is a Universal Right, aiming to improve knowledge, raise awareness and drive actions that promote and protect everyone's mental health. While wellbeing resources have become more widely available globally, people are still not getting access to resources that they really need to thrive, particularly in the workplace. So our session today will focus on the different ways organisations can implement wellbeing solutions that their employees really need to better support their mental health and how they can create a culture of wellbeing. We've included some resources in the handout section with tips and advice for spotting the signs of stress in your people. So today we'll be exploring what wellbeing washing is and how to avoid it, how to understand what support employees are looking for, how to destigmatise mental health in the workplace, steps to creating an authentic and inclusive culture, and there'll also be an opportunity to ask our experts as well, so ways to support employee mental health and wellbeing across a diverse workforce. Westfield Health's recent research into the attitudes around mental health revealed that a third of respondents feel they have no support for their wellbeing at work. Despite many companies heavily investing in wellbeing in recent years, there seems to be a bit of a mismatch between what employees are really looking for and what employers are providing, with employees across all sectors expressing dissatisfaction towards their employers' efforts. So this has given rise to the term wellbeing washing. Wellbeing washing has become increasingly popular and refers to when a company focuses more on appearing to care about wellbeing washing than actually providing the support their people need. A survey published in February 2023 by the Institution of Occupational Safety and Health revealed that 51% of employees deem their employer guilty of wellbeing washing. Common wellbeing initiatives such as free fruit in the office, employee assistance programs and mental health days off are implemented as often as one-offs without a proper wellbeing strategy in place. And this has led to a really big disconnect between employees' perceptions of employee wellbeing compared to the employees themselves. A study by McKinsey Health Institute found that employers rate mental health and wellbeing of their employees 22% more favourably than employees themselves. And these initiatives are being described as sticking plasters, while larger stress-inducing problems such as unsustainable workloads are being ignored. So with this in mind, I'd like to ask our panellists about their thoughts on wellbeing washing. How common do you think wellbeing washing has become?
So it's an interesting one, Charlie, because it seems like we've got a new sexy term for something that's probably been around forever. There has always been this disconnect, hasn't there, between what employers actually provide for their employees and what employees actually want. And interestingly, in my role as a mental health first aid instructor, I see lots of people who are put on mental health first aid courses that don't actually want to be there, don't really know why they're there. And then when I say to them, how is the organisation going to support you when you go back to work? They don't really know. And the organisation, therefore, it's just gone through a tick box exercise to send people on courses because they think that that's part of their duty of care for looking at well-being. Yeah, it's great to train mental health first aiders, but pick the right people that want to do the job and consider what you're going to do as an organisation to support them, because that then goes a long way towards avoiding the wellbeing washing and building a culture that's much more about encompassing everyone that you've got within your organisation. So I don't know, what do you think, Vicky, of this topic?
Yeah, I think, you know, we talk a lot around sticking plasters, don't we, and putting initiatives in place, but fundamentally, if the culture in an organisation isn't, you know, healthy, then well-being washing is just going to become that. It's just going to be putting sticking plasters on a toxic culture, which isn't going to help anybody. It's really going to disengage people. So I think really it's making sure you've got the right culture fundamentally before you start trying to think about well-being strategies and interventions, really.
Yeah.
I worked for a company years ago, and just reminded me, and they thought that a good thing to do was to provide fruit baskets every week, which is great. Lots of companies do that, except I was the wellbeing manager at the time, and what I noticed is that people used to bring their shopping bags in when the fruit baskets arrived, top up their shopping baskets and take it home for the family. I think that was not quite the point that they were trying to make. So then they started to restrict. You can only have one piece of fruit when it comes in. I don't think they'd really found out what people actually wanted.
Yeah, no, I've heard stories like that as well, Kathy. Thank you. So avoiding wellbeing washing is essential to ensure employees get the support that they really need. Providing the right support equally benefits employers as well, with reduced absenteeism, improved employee satisfaction and engagement as well. And to ensure wellbeing washing is avoided, it's important for employees to choose the right initiatives for their employees. Vicky, do you have any tips for employers to ensure they're making the right choice when it comes to their employee wellbeing solutions?
I think it's a great point, Charlie. And as Kathy said earlier, around people just being put on a course, whether they actually want to go on that course, and making assumptions. I think that's the biggest thing that employers get wrong, is making assumptions around what their employees want. So I think, you know, talk to your people, and it's very basic, but I think that's where it starts. Think about how you can get the feedback from what your employees are wanting around wellbeing, whether that's anecdotal feedback, you know, corridor conversations, whether it's anonymous surveys, whether it's regular mental health or wellbeing check-ins when you have those conversations with your people. So I think really talk to people and find out what it is they want, and then measure the impact of whatever you're putting in place, because how do you know it's working if you don't measure the impact of it? You know, the old saying, isn't there, around, you know, it can't be managed if it's not measured, and things like that. So measure the interventions that you put in, look at how many people are taking you up on wellbeing webinars or anything that you've put on place. I think don't just do one-off initiatives. Take your time. It's not, you know, it's not a quick solution. It can be hard to get it right, but it's worth it in the end. So I think definitely think about using data, anonymous surveys, and thinking about sort of a longer term strategy rather than just putting plasters on. Definitely.
Great, thanks Vicky. Some great examples there. And as Vicky mentioned, regular mental health check-ins are vital to understanding employee wellbeing needs. And following the pandemic, it's become a lot more common to discuss as well. The CIPD Health and Wellbeing at Work survey report in 2022 showed that organisations' wellbeing activity is increasingly focused on mental health. We also measured statistics around mental health stigmas in the workplace and found that around half, so 51% of employees, feel more comfortable asking for time off due to their mental health. Additionally, 59% say the stigma around mental health is reducing, especially in the south of England, where this figure rose to 64%. Kathy, while it's great to know that the stigma is reducing, could you share some tips for our audience to further destigmatise mental health in the workplace?
Yes, I think, as Vicky said a minute ago, this is not a quick fix. This is not something that's going to change overnight. I think it's about just taking one step at a time and thinking about how can we start slotting in conversations about mental health and well-being into our everyday things. So if you're an organisation that has toolbox talks, or if you have regular newsletters, or you have an intranet, or you have a board where on high traffic areas you regularly put messages, then start to slot them on. And I think what I've seen that's worked well is that when and particularly mental health first aiders, if they're trained, if they're willing to share something personal about their journey with mental health, then it sends a very strong message that it's okay to talk about this subject. It's okay to talk about me, my health and my well-being, in the same way that it would be fine for me to talk about my broken leg and you can all sign my plaster cast. But would it be equally fine for me to come in and say, you know, no, I'm not feeling great today, I'm feeling quite depressed, or I'm feeling anxious? It would be perfect, wouldn't it, if we can create organisations where it's okay to do that. And it starts with someone who's willing to do that. And of course, people sometimes won't do it because they risk the stigma. But so it's quite heartening to hear that the figures are getting better, that there are the 51% of people more likely to open up, not say, oh, I've just got a bad back, instead of saying, actually, my anxiety is just overwhelming. So, yeah. I think the other thing as well is another little story I heard recently. This was quite shocking in a way, that a manager in a company, one of her employees was off ill with a mental health issue. And when they came back, part of her role, she was instructed to go and speak to occupational health. So she did. She went off to occupational health, said, you know, what's the best way of bringing this person back into the workplace? And occupational health said, well, I think we need to give them a phased return, and I think we need to give them lighter duties, and I think we need to keep an eye on them. The net result of that, the person on the receiving end just felt completely penalised and patronised for having a mental health issue, because no one had actually thought to ask that person, what do you need? And the person said, well, I'm fine now, I'm okay to come back to work. And they just wanted that, you know, conversation that said, yeah, I'm perfectly fine, I can carry on and do that, not to feel penalised because they'd been off with mental health. Because let's be honest, if they'd been off with a physical illness, that's not the process that they would have gone through. So.
It's again back to those assumptions, isn't it, Kathy? Making the assumptions that they know what's best rather than actually just asking the employee, talk.
Yeah, exactly.
Yeah. Thank you, Ruth. So reducing the stigma around mental health and wellbeing is one piece of the puzzle. Westfield Health's recent research also revealed that 85% of UK employees felt there's a link between workplace culture and their wellbeing. We also know that wellbeing initiatives are more likely to be labelled as wellbeing washing when there isn't an authentic culture, wellbeing culture present throughout that organisation. So a question to both of our panellists: what are the steps that organisations can take to drive an authentic culture change to improve their employee well-being?
I think what I would say is acknowledge it's not going to happen overnight. These things take time. We know that, you know, building culture takes time. And, you know, we're a corporate health and wellbeing provider, but we're not perfect. So, you know, there's we still get people that don't want to engage in wellbeing. And, you know, we're no different to other organisations that might be listening thinking, well, how do I get my, you know, IT department to come away from their screens and engage in wellbeing activities? So we're no different. And I think it's being persistent and keep trying things and keep talking to your people. Definitely get it on your boardroom agenda. Definitely get it from your senior leadership team. From if it's them that's going to share stories, that'd be amazing if you can do that. I think it's definitely getting them to lead by example. You know, role modeling behaviour, and making sure that they are being the ones that are, you know, exemplars around wellbeing, and being able to talk about it and talk about their mental wellbeing as well. So I think there's lots of things that you can do, trying to encourage openness and conversation, share stories where you can, but don't be put off by starting with huge grand gestures. You know, start small, I'd say, you know, and see what works. Talk to people about what works and what doesn't work, definitely. Yeah, I don't know, Charlie, obviously you're our culture and development business partner. What sort of things would you add to that around what we've done?
Yeah, I think, as you said, we're not perfect. We try, but no organisation's perfect. I think one of the key things is, as you said, asking for feedback, but then also sharing those key themes of feedback back to colleagues, because from a colleague perspective, they fill out a survey, they share their feedback, and then sometimes it feels like it goes into a bit of an abyss and they don't know what's happening with that. So sharing back the key themes in terms of these are the things that we're hearing coming from our colleagues, and these are the actions that we're taking, really kind of shows your kind of colleagues across the organisation that they are being listened to, and also I suppose not over promising when you're sharing what those actions are, being really kind of considered, not rushing to share what those themes are, not rushing to action, but actually really thinking about how you can embed those actions is really important. And you know your colleagues, you know your organisation, so I think trust that you're listening, but that you also understand the people that you work with.
I think adding back to that, sorry, Cathy. I was going to say, adding back to that,
you first.
I think also we think when we think around wellbeing strategy, it's got to be huge and it's got to be expensive, and we know businesses are fighting for every pound and every penny, and they utilize some stuff that's out there. We've got a great tool on our website that will help around creating a business case to ask for whether that's financial support or time around wellbeing. So I think don't be frightened, but start doing something is better than doing nothing. Definitely. Sorry, Cathy, over to you.
No, I was just, building on both of what you're saying there, is because you're both sort of saying a similar thing about know your audience. So if you've got a predominance of men in your organisation, or women, or a particular nationality, or a particular religion, or a particular culture, then get to know what they need. It may not be the same as everybody else, because not one size will fit all. And if you're monitoring what's happening and you're not getting a very good result, then maybe you've not really understood your audience enough to know what they actually need. And I know many of you who are on this call today have heard me mention Andy's Man Club before now, which is a great charity set up to help men in the workplace. And I hear really good things about them being willing to go in and talk to organisations, because they are men who have had issues with their own mental health that are talking to men who may be reluctant to open up about it for all the reasons that we can imagine, feelings of shame and I'm meant to be the strong one and all of those things. So yeah, I think key message here, know your audience. And something you said, Vicky, as well, is that like yesterday we had World Mental Health Day. Use those initiatives. They pop up all throughout the year. There's loads of them. Know what they are, and Westwood Health can help you with that because they have a calendar of that sort of thing. Then you don't have to reinvent the wheel. Use what's already out there. Yesterday, there were loads of posters and information and initiatives that you can get involved in. You can do that for free. So it doesn't have to be expensive. So.
Right. Thanks, Cathy. Thanks, Vicky. Before we move on to our poll, we do have a question from the audience, which was, we try very hard to keep the mental health conversation going via our company intranet, but have received feedback that colleagues don't need to be told how to manage their mental health, which is a bit disheartening. How could we address this from an inclusive approach?
Oh, that's an interesting one, isn't it? Does it a little bit point towards what I've just mentioned, is that perhaps they've not understood the audience enough? It must be really disconcerting or disheartening, as you say, to get that sort of feedback. But I think recognise that you're doing something, so that's a good thing. It may not be quite right, so don't give up. Find something else that may be a better way to do it, but don't give up just before it's about to work. That's the other thing that I see sometimes. You put a new initiative in place and you get, a few people that are saying, oh, and grumbling, oh, I don't really understand, I don't want to do that. But actually you forget that you've got another 80% of people that are responding really positively to it. So make sure you've got a clear picture of what's actually going on there. Vicky, I don't know what you think. What's your experience in that?
I think it must be really disheartening, but you're never going to do something that pleases everybody all of the time. So I think, as Kath says, don't stop doing that just because you've had some feedback, because there'll be a cohort of people that maybe do engage with your intranet and do find it really useful. But again, where you're getting that feedback, that's great. At least they're talking to you. So ask them what would work. What do they want to say? Is it just a conversation with their line manager every so often? Is it something else? So at least they're providing you feedback. It may not be the positive feedback you're wanting, but they're talking to you about it, which I think is a great way forward.
Great. Thanks both. I know the team have just added a couple of those links into the chat as well, so that our audience can have a read through. Okay, so we'd now like to hear from our audience about their opinions on implementing wellbeing initiatives. What has been the greatest challenge in developing your organisation's wellbeing strategy? Feel free to add your comments in the questions section on your control panel as well. So is it time, is it cost, low adoption rates, not sure where to start, or anything else? Please do share your experience.
Really intrigued to see the answers on this. And
yes, yeah, me too. Yeah, the good thing is I still hear a lot of organisations don't have a wellbeing strategy at all. You have to have a health and safety policy. That's a legal requirement. So it's interesting that they haven't got as far as putting a wellbeing strategy in place, and including in that as well mental health, because it's all encompassing then, isn't it? So
okay, so the results are in. Time seems to be the number one, followed by low adoption rates, which I suppose touches on some of the points that you were making earlier, Vicky and Kathy, around are you really tailoring it? Is it reaching your audience in the right way? Not sure where to start, cost, and then some other comments there as well. What are your thoughts, Kathy and Vicky, in terms of some of these, I suppose, initial challenges with starting with their wellbeing strategies?
I'm not surprised, really. You know, time. You know, we all complain about not having enough time in our lives, don't we? And I think, you know, time is always the obvious one. I think it's important in your organisation people find the time, and they'll only find the time if they engage in something that's interesting to them. So I think that bit around low adoption rate, is it again back to knowing what your people want? So I think the people on the call will know their organisations better than anybody. They'll know what's working and what's not working. And I think, as we said before, start somewhere. So that bit of don't know where to start. There is loads of tools out there, loads of guidance out there. We do a great wellbeing calendar, because sometimes it's, well, what shall we talk about this month? And you don't want to keep repeating things sometimes. So I think, you know, utilise the resources that are out there. But don't make promises you can't deliver, otherwise people won't engage, because I think then they'll think, oh, that's something else that I've asked for and they can't do. Be honest with your people around, you know, pressures on resource and money. So talk to them about what would be realistic and what they could deliver. So, Kathy, if you've got anything else, you know, to add to that?
Don't put a coffee machine in if no one drinks coffee. So don't put a snooker table in if no one plays snooker. Make sure you know what you're putting in place. I think a couple of things on this one is, as Vicky said, there are lots of templates out there. Actually, I don't know if Westfield do a template for a wellbeing strategy, but there are lots of them out there which you can plagiarise mercifully. It gives you a good starting point. I know a lot of the public sector organisations seem to make theirs freely available, so you can pick on them, have a look at it and see what other people are doing, because it gives you a good way of thinking, well, okay, does that work for my organisation? Would that work for mine? Okay, I can tweak it slightly. Know what works, find out what doesn't work, so by asking your people, and also what do you want to achieve? Because what's the gap? What's the gap between what's working, what's not working, and what do you actually want to achieve realistically? Have you got a budget for wellbeing initiatives? What can you do that's not going to cost a lot of money? This question always reminds me of Simon Sinek, who wrote the book Start with the Why. Why are we doing this? If you can bottom out why are we doing it, what's our motivation, intention, then I think it's a good place to start. So, and then measure it so you know you're doing the right thing.
Yeah.
Great. Thanks both. One of the kind of additional challenges that people are experiencing has just come through in the chat. So someone from the audience said that it's difficult to get leadership buy-in. Do either of you have any tips on how to get that kind of executive leadership team on board?
I think it's back to Kathy's point about the why. So why do you want your executive leadership team on board? And showing the value that they can add and the differences. And you may not get all of them on board straight away, but you'll get one. And I think find that one stakeholder that can help you and be your champion to help influence others. So and then when you get that one, it's then talking about it, and there's elements of what can they do with their teams that then spread, you know, behaviour breeds behaviour, right? So use that in a positive way and use the shadow that sometimes your executive leadership team will create in a positive way. So I know, you know, within our executive leadership team, our CEO will often be on the phone walking his dog at the same time. And, you know, that's okay. And people like to hear that because they're like, oh, well, I might do that then. I'll take, what's wrong with an old-fashioned phone call instead of having to be sat in front of a screen all the time on Zoom or on Teams? Like, pick up the phone and walk whilst you're doing it. It's a really simple thing. So I think don't expect all of your executive leadership team on board straight away. Again, talk to them about the why. Know what makes them tick in terms of their stakeholders. If it's your finance director, what's he going to get from this? And I think utilize that knowledge you've got around your stakeholders. I don't know, Kathy, if you'd add anything else to that around.
Well, I think you were touching on what I was going to say as well, is speak their language. So if you're talking to the finance manager, find the business case for how wellbeing works. There's lots and lots and lots of case study material out there where organisations have implemented great wellbeing strategies and measured it and produced results. Go and get that information and say, look, this is what other organisations are doing, and therefore we have a duty of care. It's our corporate social responsibility to follow suit. And do we not want to be an employer of choice where we're attracting the best talent because we've got a great wellbeing strategy in place? And we have a very discerning workforce out there now, and I see it more and more that people won't go and work for organisations if they can't demonstrate that they're willing to look after their wellbeing and mental health. We've got so much more awareness about this now. And so this creates that business case, doesn't it, for the board to really take that on board.
Yeah, definitely. Thinking to what you were saying there, Vicky, around, I suppose, CEOs role modelling the right behaviours, what can managers do to role model the right types of behaviours? I suppose open to both of you.
Yeah, I suppose similar, isn't it, to the one that I just shared, but equally as well, not be afraid to say to your team, you're having a bad day. You know, I have said to some of my team, you're not getting the best version of me today. I know when I've not got the best mental energy, and I will either move meetings accordingly. So, you know, my team know by Friday afternoon, if they want something really quality out of me, they ain't going to get it because my mental energy is spent by Friday tea time. So I think, you know, don't be afraid to show the human side as a manager and what works for you and what doesn't work for you. Don't put meetings over lunch times. Like, allow people to get some, you know, space away from work. So think about the small things is what I would definitely say, and show some vulnerability in some of your own personal struggles as well. I think is important.
Yeah,
Kathy, I don't know if you've got anything else.
Managers create the culture, don't they? And so managers need to think about how they're behaving. If they come into work at 6 o'clock in the morning and they stay till 6 o'clock at night, then say to their people, oh no, I don't expect you to do that. They're not role modeling what they actually want to see. And if they're responding to emails at 12 o'clock at night, then people pick up, oh, that's what you meant to do around here. And we do pick those things up. So make sure that your managers are thinking about how they behave and that they are also conducting a wellbeing checking alongside a performance review. Performance review usually takes about once or twice a year. So for many organisations, are you actually taking the time to do a wellbeing check-in, which also means for you yourself, have the awareness yourself, as Vicky says, to know when you're not in a good way and you might need to do a little bit more on the self-care front. So
Great.
There's some interesting banging going on there, Charlie. Are you...
I know. I was going to wait until you finished talking. Apologies, everyone, if you can hear it. My builders have just turned up and decided to start banging now. So luckily, we've got through most of today's webinar without, the roof caving in. So hopefully they will bang a little bit quieter for everyone. So apologies if that's distraction. So some interesting questions there from the audience, and also some interesting results from the poll. So based on the results, what advice and wellbeing solutions do you think would be most suitable for our audience?
Sorry, Charlie, are you asking us, or are you asking the people to comment? Are you asking us, what do we think?
Asking you. So based on some of the, so time being one of the main issues, budgets being some of the main issues, what types of things can people do? Obviously, bearing in mind what we've just been talking about in terms of tailoring it to your organisation and to your people, but what types of things could people do if they really just don't know where to start with a strategy?
I'll tell you what, Vicky, I'll pick up the mental health side and you pick up the other side.
Perfect. Perfect.
So I would say...
You go first then, Kathy.
Yeah. So I would say from a mental health point of view, that if that's an area you really want to focus on, there are lots of things out there. You can have a half-day awareness, you can have a full day for wellbeing champions, you can have the full 2-day version, which is available online or face-to-face. And there's also an amazing new course actually that I've just trained in to train managers specifically to have conversations with their people, because managers often think, I don't really know what to say, or if I do say something, I'm going to make matters a whole lot worse. So there's this great course, it's a half-day course available as well, training managers to recognise when things are going wrong, and to recognise when they're going right as well, of course, but that's easier. And then to know what to do about it, how to have those conversations in a constructive manner that's going to get a really good outcome. So from a mental health point of view, there's lots of things that you can do, and you don't have to necessarily go down the route of having mental health first aiders in post, but it's to be recommended, because of course it's a legal requirement to have a physical first aider. It's not a legal requirement yet to have a mental health first aider, but it has been to Parliament several times now. And I think once they get their act together, they may well decide that it's the right thing to do, to have that parity of esteem between the two. And in support of that, you get loads of wellbeing initiatives. Vicky?
I think that course for managers sounds fantastic, Kathy. I'd like to pick up with you offline about that. I think managers have become managers, and then people just assume they know how to have a conversation. It can be hard, and it can be intimidating and scary. It's, managers are human too. They're not robots, and they don't automatically know what to say all of the time. So I think that the idea of that course sounds amazing. I think start by doing a simple survey. We can help with that. I think start there, because by showing some intent around asking your people what it is they want around wellbeing is the first port of call. I think without that, I could list a whole load of things people could go away and do, but it's not necessarily right for their organisation. One size doesn't fit all with wellbeing. And I think, I feel like I am repeating myself by saying this again, but it doesn't. So it is about getting to know what your people want. So start with a survey, ask people. And you might be really shocked at the results. You might be really reassured that you're doing the right things, but at least then you'll know that wherever you start, you're starting in a place that it will be. You won't then have the low adoption rates because you're doing things that people are wanting. So that's where I would start.
Great, thank you. Another question from our audience is that they work for an SME. How can I provide flexible wellbeing support across different working styles? So, for example, shift workers and people who are more office-based.
Make sure, if you're going to introduce mental health first aiders to your company, that you've got them represented across your shifts. I see that all the time. Oh, well, we haven't got anybody on the night shift. Well, that means you haven't got anybody on the night shift then. So, make sure that you, if you're going to select your mental health first aiders, make sure they're representative of your working patterns and your workforce. And probably similarly, Vicky, it goes for introducing wellbeing initiatives, doesn't it? Make them relevant.
Yeah, make them relevant for if you've got night shifts, don't put something on that actually your core of night workers won't want to entertain, because they might want to, in their lunch hour, rest and sleep. That might be what's important to them and their well-being in a night shift. So don't think, oh, I'll put on a spin class in the 2 o'clock in the morning if you're not going to get that adoption rate. So and I think back to Kathy's point around the mental health first aiders, thinking about where they are on shift patterns. But as Kathy said at the start of the webinar, do they want to be a mental health first aider as well? That is, make sure you get people that want to do it, importantly.
Great, thank you. And what advice do you both have for a global organisation? So how to support employees across multi-sites and also different locations as well?
Yeah, I can try and help answer that. So, we operate in 10 countries, different sites, different people. It's hard. There is not I haven't got a magic, solution for that. It's hard. But I think asking, as we said, back to asking people what it is they want and trying to be flexible, so that just because something works in one country, it may not work in another, given, cultural differences. So don't think, oh, I've done that tick. And then you've got nobody represented. It's the same with the shift patterns. Think about the same representation across your different countries as well. It's not easy, but it doesn't mean to say you shouldn't start somewhere.
And just to let I don't know the person who asked that question, from a mental health first aid training point of view, when we're delivering the course online, and all the courses are available online, I had somebody dial in from India. His internet was better than ours. His temperature was significantly higher. It was in about 40 degrees, I think. But there was no issue with him dialing in from India. And the same with, I've had people from Sweden, Estonia. I've had people from all over the world. Now, of course, Mental Health First Aid England is England-centric. But if you've got a base in England, and it's an online course, you can have people dialing in from anywhere in the world. So that, being a global organisation, shouldn't be a barrier for making sure that you've got all your staff attending the same course, so you've got that continuity and consistency of the message. And I'd imagine, Vicky, that if you've got a wellbeing webinar that's online, then it doesn't matter where people dial in from, does it?
Yeah.
Yeah, and I suppose just to add to your point, Vicky, around, I suppose, listening to different locations, I think it's a key part of it, especially across different locations. If you are functioning across different countries, is also working with key stakeholders in those organisations and not trying to do it all yourself, because that can be really overwhelming when you're just naturally making assumptions with the best intentions. It can really backfire sometimes. So really make sure that you have those stakeholders across those different locations to really support, because depending on the size of your own organisation, you might be closer to certain parts of the business than others, just naturally. So really making sure you've got those kind of eyes and ears everywhere and getting that feedback from different key stakeholders, I think, can be really helpful on that front. This might be one more for Kathy, but Vicky, feel free to chip in. How have you seen the promotion of mental health first aiders work well, and how can you get employees to engage with them?
Where I've seen it work well is when the organisation has actually treated the recruitment of a mental health first aider as a similar process to recruiting a new employee. So they've asked them key questions. Why do you want to be a mental health first aider? And how do you feel about things like empathy and confidentiality? What's your views on mental health and wellbeing already? A group that I've just had recently were asked to write a statement as to why they wanted to do the course. I thought that was a great idea, actually.
Yeah, great.
So I think recruit them properly, and we can send you a document that tells you how to do that, then it works really well, because you've got the right people. And sometimes it comes up as well that people who are attracted to being a mental health first aider, it may be because they've had a lot of their own mental health issues or experiences. And we don't discriminate, there's nothing wrong with that. But what we do is make sure that people are aware the course is not about resolving mental health issues. It's about learning how the practical skills and techniques of how to be that first port of call, that person to signpost to get the right support. And we make that very, very clear. And it doesn't happen very often, but occasionally you get somebody that misunderstands what it's all about. And then we have to say, it's probably not the right time for you to do the course because it's just overwhelming and triggering. It's, you know, it is what it is. It's a difficult subject sometimes to talk about. So it works well when they are recruited properly, and it doesn't work well when people are sent. And I usually discover that in the first, when I say to them, what's brought you here? And we have a conversation about that not being the car or the bus or the taxi. And they say, well, my manager said it would be good for me. And I think, I'm not sure you actually want to be here. So, yeah.
Thanks, Kathy.
Don't dangle it as a developmental tool. Don't say, oh, it's good for your development. I think don't dangle it as that kind of carrot. That's really sort of old-fashioned thinking, isn't it? I think people that have got a passion around it understand what it means. Talk to others if they've been on the course as well, so they get an understanding of what the course is like. I think definitely, I love the idea of that, you know, a bit of an application. We don't want to put people off showing an interest, but equally a couple of, you know, paragraphs to say why it's important to them and what they would feel they'd contribute for it is a great idea.
Great, thanks both. A question that's coming from quite a few of our audience members is how to encourage employees to get more involved in wellbeing initiatives. So how do we drive engagement from a colleague-employee perspective?
I think find that you'll have like those champions in your organisation that'll come to everything, and I think, you know, utilise them to go out and talk about it and be your sort of recruits, if you like, and spread the word. So I think don't be frightened to use employee voices around your organisation that to sort of champion any things that they've been involved in and they've enjoyed. And try different things. As we said right from the beginning, talk to your teams. Try different things to try and improve engagement.
From a mental health first aider point of view, is again what I see at the end of the course. I always say, so how are you going to let people know then that you are a mental health first aider? And they look at me gone out as if to say, what are you asking me that for? So, well, if you've done these 2 days and if you're not going to tell anybody, how are they actually going to know? So do you advertise it? You know, we send people a little badge that they can put on the end of their email. Do you put it on the screen like we're on here? Do you put, well, I'm a mental health first aider? You know, do you actually tell people that that's what you do? Or are you a little bit shy about it? Yeah, I say to people, be proud of what you've achieved and let people know, because it's going to start with you having those conversations about well-being. As Vicky's saying, it starts with the managers having conversations about well-being and your well-being champions having conversations about well-being, and then you'll get much more engagement. I think it's the old thing, isn't it, that you always get more engagement from the people that are already interested, and it's how you get those that are not so interested a little more engaged. But be realistic about what you can do to and how much engagement you're going to get. So
yeah, definitely. And I suppose that to add to that, with time being one of the challenges of implementing a strategy, I would imagine that time is often something, and does come from colleagues as well, as a bit of a barrier to being able to get involved with initiatives. So I think getting managers on board and getting managers understanding the value so that they can try and free up time to allow people to attend the wellbeing initiatives is also key, because if people don't feel like they're able to take that time, then they won't. And managers are often key to unlocking them feeling as though they've got that, I suppose, that approval to go and utilise that time. So I suppose not only kind of making sure that your board, your ELT members, your senior leadership are on board, but that managers are also very much involved in understanding the value and the importance of making sure that we are looking after people's well-being.
I think, Charlie, on the back of that, back to the culture piece, isn't it? There's no point in putting a webinar on stress management if somebody feels they're too overwhelmed in their job and they don't have enough hours in the week to get the job done. And then you say, well, come along to this webinar and we'll tell you how to manage your stress levels. It will just feel absolutely contradictory. So actually, fundamentally, have you got the right people in the right jobs at the right time doing the appropriate amount of work? I think if you're trying to overwork your colleagues on one hand and then, oh, but come along to this webinar, you know, you won't get engagement. They will be really frustrated and very disengaged. So I think think about the basics as well, that where well-being is about making sure that people are clear on their objectives in their work, what they're expected to do. It's not just about attending webinars and things like that. So I think often I hear about those kind of stories.
Yeah, definitely. And one of the other questions that's coming through from quite a few of our audience members is, what are some of the key metrics to measure the effectiveness of wellbeing strategies? So how do we, I suppose, what can you measure? Where do people start measuring, and how do they measure it?
I can give you a bit of a response from a mental health point of view, insofar as I'm often asked this, how do we measure it? How do we record conversations? And I always say it's actually good practice, a bit like your sickness absent figures. You record those, so that's of course one way that you can record figures. But from a mental health point of view, many organisations will say, every month I want you to send me the numbers of how many conversations you've had, and broadly what you spoke about. Now, obviously, you're not going to reveal who you spoke to or what it was about, but you can say it was depression, anxiety, or it was workplace stress or manager issues or whatever it is. And you can also have a tick box because you know what the common themes are that come out. And then you send that information in. And what that does, it gives critical information about what's going on across your organisation. Because if your mental health first aiders are having loads of conversations and it's always about workplace stress or manager issues, that gives you some critical information to work with, and that's good practice. And the other thing is to record those conversations. That's good practice as well, in a very GDPR way, because you get a digital footprint, then an electronic footprint of, I've had a conversation with that person, so it's the right thing to do. And I know when years ago I was a wellbeing manager myself, I'm sorry Vicky if I'm saying what you're going to say next, is that we used to produce qualitative and quantitative evidence. So we would gather survey information. So we'd do a survey, we'd gather that information. Don't do a survey, by the way, if you're not prepared to act on it. So it's like doing a stress survey and everyone goes, oh yeah, you just asked me if I'm stressed. Oh yeah, I realise I am stressed now. And then you need to do something about it. So you can do a survey, that gives you good information. And the qualitative side of it is to do some focus groups, get people together talking about this subject, and then you get the qualitative side of things. But make sure that when you do run your focus groups, it doesn't turn into a bitching session about what's going wrong. You want to facilitate them quite closely, having done them myself, where actually, yeah, let people get things off the chest, but then, okay, so what does work well for you as well? So that's just a couple of things that we used to do to try and get some metrics behind well-being. I've seen other organisations put their mental health first aiders in place. I've seen them measure the absenteeism figures at the start, gather all the information about how many conversations they've had. Then at the end of that, they've looked at how many conversations did we have? Oh, okay, we had 100 over a year, whatever it was. And then look at the absenteeism figures again. And then they could actually, by some clever analysis, say, our sickness absent figures have gone down for depression or anxiety, whatever it is. And because of that, because we've reduced those figures, that has meant that we've saved £30,000 on the bottom line of our business. That is powerful, powerful stuff. If you can gather that information and turn it into a financial metric. So I'll shut up now, Vicky. Go on. What you going to say?
I think you've got to think about what the measurements you want to capture to start with. And I think we talked about before you start a wellbeing strategy, ask your people what you want and get a baseline of where they feel their wellbeing is at that point in time. So you've got to have a baseline to start with. So where are you at before you even put any initiatives in place, and then utilise things such as Kathy said, whether that's focus groups, whether it's a people pulse, whether it's something on your intranet that can just be a voting button really quick. It doesn't have to be an onerous 60-page survey document. It can be something really simple and quick that's regular. As Kathy said, don't ask your people if you're not prepared to do something with the results. And often I think we miss tricks where we ask people, but then we don't tell them what we've done. So sometimes we need to feed it back. You said, we did. And remind people, this is why we're doing this, because this is what you've told us. So I think don't be frightened to say it out loud, because I think once you've said it out loud, you and your organisation more likely to do something about it.
Yeah, definitely. Thank you both. And I suppose other metrics that spring to mind as you were both talking then is around kind of employee assistance programs. If you use an employee assistance program, they can provide you with metrics so you can get an understanding of if colleagues are calling for mental health related concerns, personal issues. You can get data around that, and over time you can start to see what themes are coming through there, and then implement initiatives to support that as well. As Vicky said, pulse surveys. And I would say the key is, again, not to just do these once. So you do wellbeing survey or a pulse survey and that's it, we've done it. That it needs to be an ongoing strategy, ongoing surveys without kind of doing too many, but what feels sensible for your organisation based on the amount of resource you've got, the budget you've got, the time you've got to implement initiatives. What feels a sensible period of time to measure that? It might be every 6 months to start with, or actually might be annually to get a really good understanding. So again, think about what makes sense for your organisation. Another question that's come through is that somebody works in an organisation that's predominantly male but aspires to be more gender balanced. What's your advice on creating a wellbeing culture to suit the existing workforce, but will also be attractive to a more diverse population of workers? So that's a really interesting one, I suppose, in terms of tailoring it to the now, but thinking more broadly around using it as a mechanism for attracting different talent.
I think there's, thinking about what things can you put in place that are, appealing to both genders, and it's really hard because, again, making assumptions. We ran a menopause awareness course, and we encouraged as many males to come as we did females, and they got so much out of it, as much as our female colleagues. So I think often we can put well-being into genders, and I think try not to do that. Well-being, different things will apply to different people, rather than it being sort of gender specific, really. I think, Kathy, you mentioned the Andy's charity. Yeah, maybe look for something more specific, if that, to start the conversations at least.
Yeah, I had a female electrician on my course recently. Yeah. And of course, we had quite a good conversation about the stereotyping and the response that she gets when she goes to sort out somebody's electrics, and they go, "Oh, you're a woman." Yeah. No, this is, unfortunately, this is the world that we live in, and it's trying to break down those stigmas and taboos. And just to throw a perfectly curved ball in here, that when we talk about genders, I read something the other day, there's 150 different genders. Yeah, even though the NHS only recognise male, female, and intersex, there's actually 150, because gender is a social construct. That's for another webinar, though.
Absolutely, another webinar.
Yeah. But yeah, so it's a challenging one, isn't it, to accommodate everybody. Everybody.
Great, thanks both. And then the last question for today is, where's the best place to start with a wellbeing strategy? So I think you both kind of touched on where a good starting point is, but just so I suppose the final takeaway for our audience is, where's the best place for them to start the process of creating a wellbeing strategy?
So if I was to summarise, talk to your people, whether that's your survey, anecdotal feedback, start somewhere, do something based on that feedback, use the resources out there that's available, ask fellow professionals as well what they do in their organisation. Don't be afraid to LinkedIn people and ask people what they do. And I'm going to be biased to say we've got some great resources that are available for people to use around that can be downloaded and used for free as well. So they're the places I'd say to start.
And I would just only add to that, plagiarise mercifully. You don't have to reinvent the wheel. Go and find out what other people are doing and use that information. Learn from what other people are already doing, because as Vicky said, there's a lot of information out there.
Great. Thanks both. So this brings today's webinar to an end. Thank you to everyone for taking the time to join and to our panellists for sharing their expertise. We're sorry that we didn't get a chance to answer all of the questions. We had quite a lot come through, but we'll do some of our follow-up blogs on our website to try and cover some of the common topics. Please don't forget to download the handouts. We'd appreciate your feedback via our survey that will appear on your screen in a moment, and you'll also receive a recording of today's webinar as well. If you would like to speak to one of our health and wellbeing consultants about wellbeing at your organisation, either speak to your account manager, or if you have one, or you can contact us on businessinquiries@westfieldhealth.com. But yeah, thank you everyone. Thank you for your patience with the intermittent banging as well. But yeah, thanks everyone, and bye.
Bye.
Thank you.